my family saves last year was about $20,000 using CrowdHealth versus traditional health insurance. If we can take the healthy people out of the system into another system and show that this system really works, then I think we can provide a real clear alternative. That's the only way to save our healthcare system.
When you made the decision to leave the healthcare system traditionally, did you already have an inclination of CrowdHealth, or was it kind of like you took that jump and then you said, oh wait, I need a parachute, let me build the parachute?
Yeah, I'm not into parachutes. We just got to figure it out. So the three heads of the snake: hospitals, health insurance companies, pharma. They all profit by you getting sicker. The most profitable patient is a sick child. The healthier you are, the less profit that they make. So we wanted to build an alternative to health insurance that saves people money. More importantly, keeps people from going into financial debt as a result of healthcare. My daughter, who was 1 at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor. And so I went to the in-network provider to do this, got the bill, and it was $8,000. I thought the health insurance plan was gonna pay for it, or at least apply it to my deductible. But they came back and they said, nope, you think you get health insurance. You're like, man, I'm good. Just to find out that 250,000 families aren't actually good. There's got to be something different.
Andy, thank you so much for coming on the show.
Thanks for having me, man.
Yeah, this is exciting. Long time in the making. This is like my 90th episode.
Wow.
And probably every single one, this is going to be a little different.
Okay.
So I'm very interested in stories. I like hearing about stories. I understand that you have a fascinating story just in business and things. I would love to learn about that at some point. But this one in particular, I kind of want to go right out of the gate and work a little bit backwards.
Oh, boy.
Which is not something that I've ever done before, just because I think it's such an important topic. And if somebody listens to the first 3 minutes of this, I think they'll understand the importance of the conversation. You mentioned something on Case Bradford, who's a buddy of mine, his podcast. You said something like it will be the most profitable hour of like your week if you listen to it. Why is that?
Yeah, my family saves last year was about $20,000 using CrowdHealth versus traditional health insurance. And so, which is a lot of money. And we are finding that, generally families are saving $10,000. Individuals are saving probably around $3,000, $4,000, $5,000, depending upon where you live. And so we wanted to build an alternative to health insurance that saves people money. And maybe even more importantly, keeps people from going into financial debt as a result of healthcare, because I think that's a tragedy.
Yeah, so that's exactly what I was talking about. I think that's like a very poignant statement. And if somebody listens to that, I think that's compelling enough to listen further. I was unaware of CrowdHealth, or even that you could have an alternative of healthcare, until I started working with Harry and Brett, and they introduced me to CrowdHealth and the idea of CrowdHealth. I'm still 25, and thankfully my parents have a good plan, so I have one more year of their plan.
I'm putting it on the calendar. I'm calling you.
No, you should. I mean, I already have it pretty much planned. But a lot of people that listen to this podcast in particular are young men, middle-aged men, and some actually family men older in life. To me, it's fascinating because I lived 24 years of my life not even knowing that there was an alternative. Mm-hmm. Like, I literally thought you were kind of resigned to your fate. Either A, you're going to do like the riskiest thing ever and either bankrupt yourself or your family if you get injured and not be insured, or just be a part of the system.
Yeah.
The fact that there is an option, to me, is actually really inspiring and encouraging, because people like myself don't have to do that. So with that sentence, hopefully hooking people to learn more about what CrowdHealth actually is and what it does. Why did you start CrowdHealth? What's the story behind that?
Yeah, I was in the same situation as you. I thought for even longer than that. It's probably 38 years of my life. I thought it was the only option that I had. We were all psyoped into thinking that insurance is the only way. And so I bought into that. I went to the Affordable Care Act plans, the healthcare.gov plans, and got me and my family a plan. It was $1,200 a month. I think it was a $14,000 deductible or something like that. Just so people who are not familiar with health insurance, a deductible is basically what you pay before the health insurance plan will pay anything.
So would that be a high deductible plan?
That would be a high deductible plan. Yeah. And so,
which means lower premium. I don't know much about healthcare.
Yeah. They would think it would be lower premium, but we were still paying $1,200 a month. So in essence, I was paying, I'd pay something like $25,000 ish, before the health plan would pay $1. which doesn't make any sense to me, especially since my family was healthy.
Yeah.
And most of the people who are listening to this are healthy human beings who probably don't really need health insurance, but just want to look at it and be like, what if? What if something really bad happens? And so that's the way I was thinking about it. And I thought I was good to go. I didn't really like the monthly premium, but I was good to go. If something really big happens, I would be covered. My daughter, who was 1 at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor, did everything we were supposed to do. He looked into her ear and said, she's got a hole in her eardrum. And I was like, okay, well, we got to get that figured out. And so I went to the in-network provider to do this, did the procedure. It was 15 minutes, got the bill, and it was $8,000. I was like, holy crap.
Out of your pocket?
$8,000. Well, I thought the health insurance plan was gonna,
gonna
pay for it, or at least apply it to my deductible. But they came back and they said, nope, it was medically unnecessary, so you're on the hook for it completely. So I had to stroke an $8,000 check to the local hospital, and I was pissed, as you can probably imagine.
Yeah.
And it was at that point I was like, there's got to be a different way of doing this. I'm paying a lot of money, and when I need it, you all aren't there to help me. And so what's the point? And as I was starting to do research, I started off this by like, why am I doing this? Like, I hate the fact that people are going into medical debt. Not a lot of people have $8,000 sitting around to pay for, something that's pretty benign that can happen to anybody. And, come to find out, there wasn't a lot out there. And so I then started upon the journey of finding, figuring out an alternative. So we found out, like, hey, did you know you could actually negotiate with those hospitals? Like, that price is not a price that you walk into the grocery store and have to pay.
Yeah.
So you can negotiate. Like, okay, let's try to negotiate with these folks. So we started learning how to do that. You can go to a doctor online for like $69, and it's like, okay, well, I never knew that before.
Yeah.
And so I started learning about all these things. I was like, man, we can do this. We can really provide an alternative to health insurance for people, especially, folks like us who are healthy. We take care of ourselves, and the probability of something really bad happen is very, very low. And so that's why we build CrowdHealth, and that's kind of the story.
Yeah.
And one more just important point around that is during my research, I found out that 250,000 families every year go bankrupt due to a medical expense, even though they have health insurance. So you think you get health insurance, you're like, man, I'm good, and just to find out that 250,000 families aren't actually good is a tragedy, like I said. So they either get denied a claim like we did, and again, most 95% of Americans don't have $8,000 sitting around, or they have these huge deductibles where they have to pay the deductible first, and they're like, oh crap, like I got to pay $14,000 before the health plan will pay anything. I was like, there's got to be something different.
Did you stop? Like, did you just cold turkey it, say, hey, I'm done with this?
Cold turkey.
With no other solution?
With no other solution.
How'd your wife take that?
She was like, okay.
Just jumped off the ledge.
Jumped off the ledge.
That's hilarious.
Jumped off the ledge.
And
so
kind of just had to figure it out yourself, I guess.
Yeah. I mean, it's like one of those things, like you've heard the term burn the boat.
Yeah.
You burn the boat and you're like, okay, now we got to figure out how to do this.
When you made the decision to leave healthcare, like the healthcare system traditionally, did you already have an inclination of CrowdHealth, or was it kind of like you took that jump and then you said, oh, wait, I need a parachute. Let me build the parachute?
Yeah, I'm not into parachutes. I'm like, we just gotta figure it out.
Yeah.
And so over the course of probably the next year or so, we figured out, how to do this. And it was like, if we can get other people to join us in this, then we've got something really, really special. And today we're at almost 10,000 people that have joined us in this journey of being uninsured, which is scary to a lot of people. But for me, it's like the most freeing thing because I don't have this health insurance plan, sitting on my shoulder or sitting on the doctor's shoulder saying, you can do this, you can't do this. It's now between me and my doctor. I say all the time that you work for whoever pays you. And with the insurance plan, guess who's paying your doctor? It's the insurance plan. Mm-hmm. So your doctor is working for your insurance plan. They're not working for you.
Interesting.
When I pay my doctor, guess what? The doctor now works for me. And
it should be.
And that's the way it should be. And just the interaction with the doctors are so much different when you're paying yourself because they now have to satisfy you, the customer, as opposed to satisfying the insurance plan. And I had something, that I thought was going on about a year and a half ago. And so I went to the cardiologist and he's like, look, I want to do these tests. And typically what I would do is I'd call you back into the office. But since you're paying on your own, can I just call you and we can skip the office visit? And I'm like, hell yeah.
Yeah,
like,
sounds great.
So he called me, gave me the results. Everything was great. And I didn't have to spend, an hour or 2 hours to get to the doctor's office, to sit in that waiting room. And so the doctor treated me like a human being as opposed to just, another person walking through the door because I was paying.
Too.
Oh, it saves him a ton of time.
And money, probably, I'm guessing. Maybe make some money.
Yeah. And at the end of the day, guess how he got paid? I gave him my credit card. Boom. Here it is. And then we got a back end system to help me, pay for that. But, it was great for him because he no longer had to bill the insurance company and do all that, stuff. He got paid directly by me at the point of care, and he loved it. And he's like, hey, can you send more people my way?
Yeah, because it's a win-win.
Yeah, it's a win-win. And so if you can build business models that are win-win, win-win for the provider, win-win for the customer, I mean, you got something really special there. So, all these kind of things happened in tangent. I think there was some divine intervention there that are like, man, we can really make this work. So here we are, 3.5 years later, and, every bill that was submitted to the community got paid. And it's been we just had our first profitable month last month.
Nice.
And so it's working.
Yeah, that's exciting.
Yeah.
The thing I just thought of is it's actually a win-win loss. It's a win for you and the party that's doing the service, like the doctor, and a loss for the middleman.
Yeah, exactly.
which is exactly what you want.
But it's a win for the system too,
Yeah,
right?
totally.
I mean, the system clearly is falling apart.
Yeah.
Our healthcare system. We are trending towards a single payer, which is, a Medicare for all type of thing, which means your government now is in charge. So now you would have not only the insurance company between you and your doctor, you have the insurance company and the government between you and your doctor. And it's just like, man, is that what we want? Like, that's not what I want.
No.
And if people want that, then they're probably not going to sign up for CrowdHealth.
Yeah.
We're looking for people who want to be like sovereign individuals, but want to be responsible for their own healthcare. And as a result of that, we've been attracting people like me and you who, take care of ourselves and make that, the highest priority. So it's a great group of people to be, funding each other's health expenses.
Yeah, it's fascinating. It's also, you mentioned something about the idea of this is how it was. Like the community, this is how it used to be. Like you lived in a small town in Kansas and somebody got hurt or somebody like lost a loved one. Like the community, it takes a village. The old saying, it takes a village. That's more or less what this is. It's like the village. It's a proverbial village.
Exactly.
Which is super cool to think about. There's not this guy in the middle that's literally profiting on both sides, basically just dictating what happens. Like it doesn't make sense to me. I don't like communicating with middlemen anyways. It's similar to Bitcoin, and I'm sure at some point this conversation will get into the connection there because like the banks and the correlations between that and the health system. But a question that I have, like, more directly towards like a younger man like myself, maybe somebody who's like getting off their parents' plan or like mid to late 20s, recently signed up for health insurance or whatever, in the most concise way possible, if you can. I know it's like kind of a challenge. What would you say to them, to that person, to compel them to if they've never questioned healthcare before, if they're like looking into the fact that they're paying this money and they're listening to this conversation, what would you say to them to compel them to look at the alternative that is CrowdHealth?
Yeah, I think the question you want to ask yourself is, what are you okay paying for, right? And with health insurance, you're paying for just about everybody in the population. You're paying for their lifestyle habits. You're paying for the costs associated with those lifestyle habits. And so do you want to pay for that, or do you want to pay for somebody else like you, for example, who you might fall off your mountain bike, or you might do something like that, or have a baby, or one of those things, or do you want to pay for those things? So 25 cents out of every dollar that you spend on health insurance goes to a person with diabetes. And the vast majority of that is type 2 diabetes. And that 95% of it is type 2. Type 2 is a lifestyle disease. It's a lifestyle condition. It means you have put your body through pretty much hell for a long period of time, and your body is saying, I can't do it anymore. And as a result of that, you have massive, massive costs associated with your body's inability to regulate blood sugars, heart issues, all kinds of issues, insulin injections, all these things that you have to do and pay for as a result of not taking care of yourself. And so we've got a community of people. Our average age, I think, is like 33, 34. We have a limit on what you can weigh. We give you additional benefits if you're metabolically healthy. And so what community do you want to be a part of? And what we have found, especially for young males, it's like, man, I want to be a community of people where, I'm sitting next to you at the gym as opposed to sitting next to you on the couch slamming brownies, right?
Yeah.
Like, I don't mean to be crass about it, but we do need an incentive system within our country, given that 70% of the United States is overweight, 50% is obese. We have to have an incentive system to say, no, look, you are responsible for your own lifestyle. You're responsible for your own body. If you treat yourself well, your healthcare costs will go down. And so people, for some reason, don't seem to be incentivized to do that unless it hits them in the pocketbook. And so CrowdHealth is a third, oftentimes less than your alternative because, one, we're getting way better prices for our members. And we can talk about that. But two, we've got a group of people who've come together and it's like, man, like I want to fund other people who live the same lifestyle as me. I don't want to subsidize people who are not living the same lifestyle. And I think that is good for the system. It's good for healthcare because if we all ate better, we wouldn't need CrowdHealth.
Yeah.
Our costs would go down 70, 80% probably, right? And so I think it's good for the system to incentivize people, be like, no, here's a group, you can save a bunch of money if you take care of yourself. I think that's a positive thing for the United States. And some people will disagree with me, especially those who want Medicare for all or on the kind of progressive side of life. They don't agree with that. And that's okay. It's not for everybody.
Yeah, the idea that I would be paying my money as somebody who's extremely diligent and intentional and like puts a high investment into my health on the front end, the idea that I would then have to put also money in the back end to pay for people who don't do that, pretty disgusting to me.
Yeah.
It repulses me actually.
Yeah. And some people out there, and this is our biggest pushback, will listen to this conversation and be like, I can't believe you guys would say that. And that's where I think is the problem.
Yeah.
It's like, no. Why shouldn't somebody who's taking care of themselves, I was out at dinner last night and man, when you sit there and you look at this dinner, it was a great dinner, by the way. It's like, okay, I can have a couple drinks or I can have dessert or I can have all these kinds of things, but I'm not, because I want to keep my blood sugars in line. I want to stay metabolically healthy. I know I'm not going to sleep well if, and that has a metabolic impact. And so like I'm making sacrifices for making sure that my body is functioning properly. And I was like, man, if I'm willing to make those sacrifices, then I feel like I should be compensated for that at least, and not have to subsidize others who aren't willing to do that. So,
or at the very least, not have to, like, even if you're not compensated per se, at the very least, not pay, like literally pay for the decisions, the lack of sacrifices on
for sure.
the other side of the coin. I find that to be fascinating. And the other thing it's almost like embarrassing in a way that like that we're just, because I know I'm not alone in thinking there's like no alternative. We're literally just like psyoped for like a lot of our lives into thinking that that's pretty much the only option. Oh, like you have to do this. There's literally no other option.
Yeah.
It's embarrassing in a way that because it's just taking away sovereignty. And as you mentioned, like many people that listen to this are 100% in alignment with that, like living a sovereign life.
Well, here's the other thing too, is the incentive system is so screwed up where the insurance companies actually make more money if you're sick. People don't understand that. So, and they make more money if they deny your bills when you do get sick. And so do you want somebody, we have a principal agent problem. They're supposed to be our agent. They're supposed to go out there and find us the best deals, that, use their size to be able to negotiate. But in reality, what's happening is they're actually making more money the more sick we are. And we can kind of walk through like the details of that, but it's sad to me that that's the way that it works. Whereas CrowdHealth, it's like, no, we actually make more money if you're healthy, because you're going to stick around with us longer. Your bills are going to be lower. We're going to be able to attract more people to the community. Like, who do you want on your side? Somebody who makes more money if you're sick, or somebody who makes more money when you're healthy? That to me seems like an obvious choice. But other people disagree.
It's pretty cut and dry to me.
Yeah.
There's this idea, I've seen this graph before, and you've probably seen this as well, where since 1970, back to the currency and the fiat versus Bitcoin and all that stuff, 1971, I believe, is when this graph started. And since then, there has been like a 3,200 or over a 3,000% increase in healthcare administrators.
Yeah.
And the quantity of healthcare administrators, 3,100% increase, something like that. There's been like a 200% increase in actual physicians and doctors.
Yeah.
Where is that? What's going on there?
Yeah, I mean, it's just the bureaucracy of healthcare, and the vast majority of it has to do with how they're paid. So every doctor, not every doctor, on average, a doctor needs about 3 billing people to bill for them. So one doctor, 3 billing people. Just assume that a doctor makes on average $300,000 a year. You have 3 billing people who are getting paid 60 or 70 grand a year. You're basically paying 50% more than what you need to pay because they have to just bill health insurance. And so you get rid of all of that bureaucracy when I show up with a credit card. You're paying 2% or something like that on my credit card fee. And so if you can rip out that administration, that bureaucracy, you can significantly lower costs. So, and many times we're getting 50, 60, 70% better prices for our members than health insurance plans. So this is United Healthcare. It's, I think, the 6th or 7th largest company on the planet by revenue. Can't negotiate a better deal than you as an individual can go in and negotiate that deal. Now, CrowdHealth, we'll help you negotiate it. We negotiate it for you. But the reason why we'll be able to do that is because the hospital or the doctor or whatever looks at this and said, I can get money now, with these guys versus me having to fight with the health insurance plan to get paid with them. A doctor spends about a day a week, so say 20% of their time fighting with health insurance plans. On top of billing, like, wouldn't you want to be, most of them get into this because they want to help patients. They don't want to fight with health insurance plans. So we're giving them a whole day back of their time if they were just to take cash pay, patients like CrowdHealth members. Yeah,
and that's less time doing something as arduous and tedious and probably angering as fighting with healthcare, and more time to see more clients or more patients if they need to, and can help more people and probably make more money. And there's lower costs on the back end. So, I mean, it sounds like that's another thing I didn't really think about until this conversation is it's like a financial incentive for them as well. Like, not that it's all about finances. Like, you don't want profit to be the number one thing, but most doctors' offices are for-profit organizations.
Yeah.
It would make sense that they would be incentivized to use or to encourage people to use a platform like CrowdHealth because they make more money too, and they can actually help more people, and they can save you time and money. So, I mean, it's a win across the board.
Yeah. Interestingly, our customer base, number one category of people who join us are entrepreneurs, freelancers, gig workers. Like, they're doing their own thing, small business owners. The number two is healthcare providers.
Interesting.
Yeah. So it's doctors and nurses. They're seeing this firsthand that this system is broken.
They've seen
they don't want to be a part of the insurance system. And so they're signing up for CrowdHealth, which I think is really, really interesting.
I feel like it's a green light for y'all, knowing that people that are on the inside are like, oh,
some of our biggest advocates.
Yeah.
Biggest advocates.
Okay. You mentioned, we can get into the details of like why it's so expensive. I think that's what you were saying. To go through like healthcare, why that middleman makes it so expensive. Could we dive into that a little bit?
Sure.
Like, what are the actual like mechanisms by which that middle party of the health insurance companies, why do they make it so much more money?
Yeah. And so the way that health insurance works is that they are limited by the amount that they can make dollar wise. And so if you have a premium, which is how much you pay every month, of $1,000, we're just going to use round numbers to make it easy. The max they can make is $150. So they can only make 15% of the premium. So the question then becomes is how do they grow, right? If they want to grow 10% to go from 150 to 165, guess what? The premium has to go from 1,000 to 1,100. So they actually make more money as your premiums go up. So that's the perverse incentive of the insurance plan. So the buyer of healthcare, which is primarily health insurance plans, wants the price to go up. the seller of healthcare, which is these big hospital systems, of course, they want to make more money. They want the price to go up. And so, it doesn't take an economist to figure out when the buyer of healthcare and the seller of healthcare both want the price to go up, the price goes up.
Yeah.
And so it's a pretty simple reason why, healthcare is getting ridiculously expensive, because all the incentives around the system is that, you want healthcare to go up. So if you get a bunch of healthy people getting together and your premiums go from $1,000 to $500 a month, if you actually try to drive prices down, it means you actually make less money. And so that's why this is so screwed up. The incentives are everything. And I think, as a Bitcoiner, is just, anybody who lives life and is in business understands, follow the incentives and you'll figure out, which way the price is going to go and how well they're going to take care of you.
Yeah, I think it was Munger or Buffett, Charlie Munger or Warren Buffett, who said something like, you get what you incentivize for.
Yeah.
So true. That just reminded me, I think that the number is how much did the U.S. spend on healthcare? Like 4 trillion last year?
4.6 trillion.
4.6 trillion.
Which, by the way, I think is like the third or fourth largest GDP if it were a country.
Yeah,
it's like
insane.
It's behind the United States, China, and Japan. And it's about to exceed Japan. And I think in the next 5 years, they're expecting it to exceed Japan's GDP. So it's crazy.
Yeah, that's so much money that I don't think it's possible for a human being to actually comprehend it. But the number associated with that I've seen is, I want to say it's like $13-something thousand of healthcare spend per capita in the United States.
That's about right.
And I'm pretty sure it's the highest in the world.
By twice as much.
Yeah. But America is, as it relates to developed nations, is really not in super good standing as it relates to metabolic health and chronic disease and obesity and things of that sort. So that's one thing that I find interesting as well. It's we spend more money on healthcare than anybody in the entire world by a complete landslide. It's not even remotely close. Yet we're what's it going to? It's going to people getting sick.
Yeah.
And I think it goes back to what you said. They profit off of sick people, not healthy people. Where does that end? Do you see that ending at all, on a national level, or is it really just take the individual, you and I or CrowdHealth members and people that are interested in that type of thing taking steps for their individual lives, or do you see a world where the healthcare behemoth can be quelled, I guess?
Yeah, I mean, ultimately, it's a good question, multi-pronged. I think we're heading towards a single payer, meaning healthcare is governed by the government, unfortunately. Mm-hmm. I think that's bad for the United States. I think it's bad for us as individuals. And so, what we're trying to do is start a movement to say, no. If we can take the healthy people out of the system into another system and show that this system really works, then I think we can provide a real clear alternative politically, can get people to understand this is the way. Because if we can reduce that obesity level, reduce the number of people with metabolic dysfunction, that's the only way to save our healthcare system, truly. And I just don't think you can do that under a government-run system where there is really no financial ramifications of you not taking better care of yourself. I think there has to be ramifications of you not taking better care of yourself. Now, look, 80% of our healthcare costs go to people who have lifestyle-related chronic diseases. There is the 20%, they just got the raw end of the deal. Mm-hmm. I was talking to somebody this morning who, incredibly healthy, metabolically healthy, and, had colon cancer. And that's just they got the raw end of the deal. And those people should be taken care of. I'm not saying those people shouldn't, but for the 80% where you could have lifestyle changes in our 20s, 30s, 40s, so that we can live well in our 50s, 60s, 70s, that is the only way to change our system, right? And so let's get into a group of people who want to change the system in that way, want to be metabolically healthy. And I think we really can have a startup movement, not just in reducing healthcare costs, but increasing the value and the thriving of people in their lives, right? Nobody in their 60s, 70s, 80s wants to have COPD or congestive heart failure or, diabetes or some of these other chronic diseases. I say it often, I want our members to be in their 80s playing wiffle ball in the backyard with their grandkids. Like that's ultimately what my desire is. And if we can fix the healthcare system along the way, yeah, praise God.
Yeah.
But like the worst thing is to die slowly, meaning you have a chronic condition over a decade, ends up killing you and costs the system a bunch of money and doesn't allow you to thrive, right? And so it's like, man, folks, let's take care of ourselves in our 30s, 40s, and 50s. Like that's where we need to focus our time, right? And I'm just trying to inspire people to do that. And I think one of the ways to do that is like, and you're going to save a bunch of money. How awesome is that?
Yeah.
And we're seeing, here's some cool stories where we have people who want to join CrowdHealth, can't because of their previous lifestyle habits, and then reach back out and said, I finally hit the weight limit. You know, like I had a guy about 6 months ago who has been following us for 2 years. He was significantly overweight. He dropped a bunch of weight, and he sent me a picture of him and his wife doing a triathlon. And he's like, I'm finally down to a weight where I can join CrowdHealth. I'm like, dude, that's awesome. That's incredible. Incentives, right? And he was so excited. You know, he's like our best member now because he's, you know, he's just a CrowdHealth prophet, I feel like.
Yeah, which is awesome.
Yeah, which is amazing.
You just mentioned something. It's so funny how this works. I have a newsletter, and 2 weeks ago I wrote one titled "I Thought About Death" because my grandfather is like he's 86 years old, very very close to dying, and I highlighted 2 questions that made me think about, and one of them was how do I not want to die? And there's this idea that I've heard. I think it's from a book, but I'm pretty sure I used your exact term. You just said I want to die fast instead of slow.
Yeah.
And it's the idea of like live, die.
Yeah.
As opposed to live a little less, get a little closer to death, death.
Yeah.
You know what I'm saying? So like it's just funny that made me think of that. It's cool how that's, hopefully that's going to continue to pervade the system. I can't remember what the book is called. Younger Next Year, I believe. Okay. It's like have you ever seen The Graph? Have you ever heard of that book?
I haven't heard of the book, but I think I know the graph you're talking about.
Yeah, it's like instead of a linear progression or a linear decline towards death, it's like a inverted exponential growth curve where it's like, and then that's why I want to die. Like to your point, like there's a guy named Donahue Wildman who I think you would find fascinating based on what you just said. He was friends with Laird Hamilton, if you know who that is, the big wave surfer.
Yeah.
The year that he died, he was 85 years old. He founded like Bally Fitness out in Cali or something. Pretty successful businessman. 85 years old, he died in like 2 or 3 weeks from brain cancer. That year, he surfed, he snowboarded from helicopters, he worked out, he played golf, he trained, he lifted weights, all this stuff. Helio Gracie, one of the founders of Jiu-Jitsu, creators of Jiu-Jitsu, is another one. He was 85 years old rolling with his sons and grandsons. To me, that is like a massive North Star.
Yeah.
Like
Amen.
That's like I'm optimizing my life now so that's a legitimate possibility. One of the things, it's a little bit of a tangent related. Healthcare is not the only thing that profits off us being sick, because to get sick you have to eat bad foods and not train and all these things. So there's the big food, the big healthcare, and the big pharma, like 3-headed snake, you could say.
We call it the medical industrial complex.
The medical industrial complex.
Yeah. I
like that. I've never heard that. The medical industrial complex is very intertwined. I think that it probably stems back. I think it really hit its tick when we became fiat currency nation, but there's obviously even like seed oils and stuff were created long ago. There's been people profiting off of things that are not necessarily healthy. But how are those three on like a high level? How are those 3 things connected? And how does like joining CrowdHealth help you also separate from those other 2 heads of the snake? If that makes sense?
Yeah, no, totally. I mean, I think that so the 3 heads of the snake. Hospitals, at least from our perspective, hospitals, health insurance companies, pharma, right? They all profit by you getting sicker. You know, I saw something the other day and it made me sick. It's like the most profitable patient is a sick child, right? Because you got that child now probably for the rest of their lives. You're pumping them with pharma. They're going to the hospital. They are jamming their insurance and allowing the insurance companies to charge more and more and more. And so these are all, you know, very, very closely linked, that the healthier you are, the less profit that they make, right? And so there's no incentives for them to make you healthier. Peter Thiel talks about this all the time, where we've made incredible innovations on things that are digitized, you know, like software and things like that. We have not made much progress when it comes to things that include atoms, you know, the actual tangible improvements. And one of the things he talks about is like, why hasn't there been any substantial improvement in the pharma industry, especially for the chronic diseases, for the last, say, 3 or 4 decades?
Even as that the expense and the money coming into the system is skyrocketing.
Yeah, exactly.
That's a great point.
Right. And Goldman Sachs had an analyst that says, is it profitable to cure a patient? Like, that was actually in one of their research reports. And so you can think about, like, if your shareholders are telling you it is not profitable to cure people, what are you going to do? You're going to keep pumping them with things that are going to reduce the symptoms, but aren't going to actually cure you. And so that's the challenge that we have with our system. Pharmaceutical companies are the number one spender of advertisements on TV. And so what do? They're able to advance their narrative because they are the ones paying the bills for these TV companies, these media companies. And so I think those three are incredibly linked. And I'm not saying that pharma is not the right situation for some things. We look at it as like, you've got to make lifestyle changes before you jump into pharma. Few people know this, but type 2 diabetes can be cured with a lifestyle change. And I've Sean Baker, I'm sure you know Sean Baker, others, Dr. Chafee, folks like that, who was like, no, if you go on a low carb diet for 3 to 6 months, the vast majority of people can get their body metabolically back to where they need to be, so they can not having to inject insulin into your body, multiple times a day. And so that's where we need to make our focus, is those lifestyle changes. One of the things that we've done at CrowdHealth recently is we've started a carnivore crowd. Mm-hmm. And in essence, it's a low carb crowd. It's folks who take their A1Cs, their fasting insulin, their visceral fat levels, and they know what those are. They watch them on a recurring basis. And we know that if you can keep your fasting insulin down and your visceral fat down, the probability of you having lifestyle-related chronic conditions is decreased probably 90 or 95%. And so those people should be able to get together and say, hey, I want to, be a part of this with you. And so those are some of the things that we're doing to allow people to really understand how to be metabolically healthy. And as a result, you don't need insurance as much. You don't need hospitals as much. You don't need pharma as much. And that's why all three of those parts of that three-headed snake hate what we're doing.
Have you seen any like actual pushback from anybody in the healthcare industry, healthcare companies?
Sure. Yeah, for sure. For sure.
In what ways? Just
we've had regulatory agencies reach out to us who, again, oftentimes either directly or indirectly are compensated by, some of these, one of the three heads of the snake. Fortunately, we've gotten through all of those regulatory issues, but they want to, shut us down because we're not good for them, and we're getting people healthy.
Yeah.
One of the things that we love to do is have kind of monthly things that we educate people about, and then allow people to go and get get funded by the community. So we do DEXA scans,
Nice.
We do labs, we do VO2 max, those types of things to be like, hey, here's the things that are important in your life that you need to be focused on, and let's focus on that stuff, as opposed to paying, ridiculous premiums to health insurance plans.
Yeah, well, if you're not spending $1,000 on a health insurance plan, and you're spending $500, then you have more discretionary income to, I do want to see what VO2 is. I do want to see a DEXA scan, all this stuff. It makes total sense. And once again, it's the incentive thing. Like, I love the idea of like the exclusivity part of it.
Yeah.
Because that's an incentive. Like, if everybody could lower their plan, they would, but you can't. So if you want to lower your plan, you have to do certain things that then, if you do those things,
Sure.
it benefits the other people that are also doing those things. And this is why I like the idea that you guys are very intentional about saying community. It's
a key component of what we do.
It's real though too. It's not just like some word. Like, that's actually how it feels.
Yeah, I've interviewed. One of the things I do as CEO, I talk to our members. I've interviewed probably 20 members over the last week and a half, and all of them have said, and when I ask, like, why are you a part of CrowdHealth? They're like, man, I feel like I'm a part of a community. Like, I'm a part of a community of people who have the same worldview that I do around lifestyle, and I want to be a part of that. And so community is huge for us, and we do lots of things to help with that community. We were just at the Bitcoin conference a couple of months ago, and we had ribeye or a tomahawk eating contest.
I was there too. I was working the door.
Oh, yeah, that's right. Yeah, we did it with the Meat Mafia guys. And it's like we had 100 people there or more, CrowdHealth members there. We get people together in community. We had a guy. This is how much people love CrowdHealth, and I'm saying this humbly because I'm overwhelmed by it. We had a guy that drove from Orlando, Florida, to Nashville, Tennessee, which I think is a 13-hour drive. He was there for 4 hours. He got the hotel and he left back for Orlando at 6 a.m. the next morning. I'm like, you did what to hang out with us? Like, it's cool because he's like, man, I just want to be a part of our community members. I was like, that's pretty darn cool.
Very cool. I remember, like I said, I was working the door and we were giving out wristbands. And I feel like every other person was like, you for CrowdHealth? And I'm like, yep, right over there.
Yeah, it was fun.
That's exciting. It's very exciting. The community aspect, I think, is huge too, because just like I think about things a lot of the time through that paradigm of like what I believe to be like the tribal nature of human beings and through specifically like American Indian culture. I just find it fascinating how they lived. The reason that like I would help you out, and Jordan Peterson actually talks about this too in terms of sharing. Like the reason that I share with you is because it's not a selfish endeavor per se, but there's a selfish component to it, because if I share with you, the likelihood of you sharing with me if I need it is increased. So you win and I win. It's one of the beautiful things of humanity. It's
sure.
Like, if I share with you, you're going to be more likely to share with me, and then we both win. In a community, the more I help out my neighbor if he's sick or if they need help building the barn or whatever, when I need to build a barn, they'll come help me build the barn. Sure. It's the same exact
It's just a part
deal.
of human nature.
Exactly.
And it has been there since the beginning.
Yeah.
I'm doing Nolan's podcast. I hope Nolan will come and do my podcast.
Yeah.
Right? Like there's just, and it's not because, I'm doing it for the reciprocity. It's just,
it's the nature of things.
It's just the nature of things. It's just the nature of how we work. A cool part of what we do, and I think maybe one of the biggest differentiators between us and health insurance is where your money is going every month. I know that if you break your arm and I'm asked, it's going to someone in Austin, Texas who broke their arm, as opposed to going to the health insurance company. We had a gal last summer who had her fingers chopped off in a boating accident. And it was, as you can imagine, a huge bill. Mm-hmm. And so we went out to our community and we say, hey, we have this 19-year-old. Her name is Abby. She's okay with me sharing her name because we've done a thing on her. And we've had people come back and we asked them for $100. And they came back and said, hey, can I give $200 to Abby? Because, man, I couldn't imagine, like, she's a part of my community. Like, I couldn't imagine a 19-year-old not having her fingers anymore. And so it's like, you would never in a million years, be sending more money to United Healthcare. You would be like, hey, United, can I send you more money this month?
Yeah, but just Venmo the CEO.
Because it's somebody in your community, there's a sense of generosity there because you're a part of my tribe, right? You're a part of my CrowdHealth tribe.
Yeah.
And while I've never met you, like, I know that you share the same worldview as I do, and so I want to help. And so I was like, how awesome is that we can instill generosity within healthcare as opposed to just a commitment to pay, the $25 million a year to the CEO of United Healthcare or whatever it is. Yeah. And so there's a pretty special component there of community helping another human being. It's just cool. I love it.
Yeah. That's absolutely fascinating. I do think that that makes sense. That it makes sense to me intuitively. Like when I hear that, because there's like, even I just had a little like emotional response. I'm like, oh, that would suck being 19 years old as a young lady and having no fingers. That sucks. If I'm in a position to help and I'm healthy right now, and that's a sad story, and I feel bad for her, and she obviously does have the same or similar worldview as me because she's in CrowdHealth, then I'd be obliged to help with the understanding, not like a selfish way, but like with the understanding that God forbid anything like that ever happened to me or to my son or something like that.
My people will hear from me.
Yeah, exactly.
Yeah, for sure.
It's that's powerful.
All right, I think one of the things, and this goes back to the 1970s, where I think government started playing a much larger role in our lives, both through the kind of, going off the gold standard. The HMO Act happened, I think, in 1972 or 1973, which had basically codified our current insurance laws. What has been happening over the last 50 years is the government or other corporations have gotten in between me and you. And so I no longer feel an obligation to help somebody in my community because the insurance company's got it. or the government has got it, right? And so I think that sense of generosity, that sense of like wanting to help a fellow human being has gotten stolen from us by these government or government-related entities. And back 50 years ago, when somebody moved in next door, what would you do? You'd bring them cookies or whatever, 100%. Right? And you just don't do that anymore. And some parts of the country you do, but most parts of the country you don't. And what do you do when somebody moves next to you? It's first focused on, oh, well, how much do they, buy the house for? Because that's an indication of how much my house is. Like that generosity, that love of neighbor has gotten stolen from us because we've been psyoped in thinking somebody else is going to take care of it. If you go, and I'll be honest with you, like if I'm going down, we live in Austin, there's homeless people, oftentimes in my mind is like, man, why isn't that guy getting taken care of by XYZ government, thing?
Yeah.
Whereas what my thought really should be is that's a member of my community. Like, how do I help him or her, in that time of need? And our brains have gotten desensitized to other people who really need help because we're now relying upon the government, relying upon insurance companies, relying upon somebody else, where it's like, no. We as our community members should be acting as good community members, love each other well, and help them. And that's why I think some of the extreme negativity within our society has really bubbled up, in the last 2 or 3 decades, especially, is because we don't have a sense of commitment to other people. We look at other people as a political party or whatever it may be, and was like, man, like we need to love each other well, help each other. But this government intervention, from my perspective, has really stripped us of that. Yeah. And I think that's ultimately what's happening in our culture right now, why we hate each other, because we don't have a commitment to one another.
This is so fascinating. I love this idea. I'm going to butcher the quote, but it's George Washington. I mention it all the time because I think it's so important for us to realize, and it's actually fascinating that he, founding father, first president of the United States, said this however many years ago, 250, whatever.
Yeah.
Yeah, 250, right?
Yeah, a little more than that.
Yeah. I'm bad at math. He said something to the effect of political parties will be the death of the nation because people will associate more with the success of the party than the nation.
Yeah.
And it's a similar gist, right? Like we don't have a commitment to them. We have a commitment to the red or the blue, or like even your point is funny, but like it's almost like we have a commitment to the healthcare companies or like the health insurance companies as opposed to our fellow neighbor. The other thing that reminds me of, I think it's called like the bystander bias or something. Have you ever heard of that?
I haven't.
Where I might be butchering the name, but it's this idea that the more people that are around, or the more potential helpers or assisting parties are around, the less likely the person that needs help is to be able to get help.
Sure.
Whereas if it was just you and me and you were injured on the floor over there, I'd be like, oh, what's up, Andy?
I need help.
Yeah. But if there's 20 people in here, I subconsciously assume, oh, okay, he'll get it.
Yeah,
Somebody else will get it.
Well, there's that story, I think it was New York City, where there was a woman who was in, I don't know what exactly was happening to her, but she was yelling out, help me, help me, help me, help me. And it was in this, place where hundreds of people could help, and nobody helped because they always thought somebody else was going to help.
Mm-hmm. Yeah.
And it's like, man, what has happened to our brains, right? To think that we're not the one that is responsible for helping. And I think, and some people can look at this and be like, oh, well, that's socialist and all that kind of stuff. I think that's BS, right? It's like, no. We want a group of people who are sovereign and take personal responsibility in a community that are willing to help each other when in need.
Yeah.
I mean, if I'm going to be in a community, I want to be in a community of people who are personally sovereign, who are taking care of their stuff, right? And then when something bad does happen, or when they have a baby and are growing the community, then, man, I'm the first one to be like, yeah, I want to help. Like, that's what I want, right?
Yeah.
Our number one expense is pregnancies, people having babies, right? And I was like, man, I'm all about helping other people,
Great life, hell yeah.
Populate awesome. The planet. The second one is injuries. And so it's people who are, doing face plants on mountain bikes and, tearing their ACLs, out running or something like that. I was like, that stuff's just going to happen, right? That's just a fact of life. Yeah. And so I'm happy to do that, right? So very little is going towards, disease. Almost none of it is going to disease. Very little of it is going to illnesses. We've had about 20 cancer cases, but even most of those are not because people are not taking care of themselves. They just got the raw end of the deal, unfortunately.
Mm-hmm. Yeah, on that note, like from an actual infrastructure and execution standpoint, how does it actually work? Like if you could just run through it, like I submit a claim or something, say I break my arm or break my leg or face plant on a mountain bike, what happens next?
Yeah. First off, we have somebody internally who's your care advocate. So you have somebody to call, you have somebody to text, email, whatever you want to do. So there's somebody at CrowdHealth who's going to be assigned to you to help you through whatever situation that you have. So it's not you calling into a big call center and being like, somebody help me. And then they, punch you to, it's probably somebody in India or somebody.
It's like some Indian dude trying to help me with my healthcare.
Yeah. It's like 12,000 miles away trying to help you with your healthcare, here. You can call somebody and be like, man, I broke my arm. I'm in the ER. What do I do? And so that's the great part. You have somebody here who can advocate on your behalf. If you go to the ER, let's say you go to the ER, and what we do is go to the ER, take care of yourself. You are a cash pay patient, so just tell them you're a cash pay patient. You will leave the ER. They'll start sending you bills.
Is that something you would say up front? Because this is another thing. I literally didn't even think that you could just say, hey, I'm actually not paying for it.
Yeah, it's like they'll ask you like, hey, what insurance do you have? And you're like, I'm cash pay. And they are by law required to treat you the same way as they would in insurance if you had insurance. So that's not an issue. Hasn't been an issue in our 10,000 people, our 20,000 bills that we've gone through, has not been an issue. And so you just say, I'm cash pay. They'll start sending you bills. You upload the bill on our app. We take a look at them. We consolidate them. We will then negotiate on your behalf with the hospital to get those bills down. And we're, getting the bills down, like I said, 50, 60, 70, sometimes even 90%. We had a lady the other day. This is a crazy story. It's almost unbelievable. A pretty run-of-the-mill surgery. She asked for a quote. She got a quote of $119,000. She sent it to us, and she's like, I'm really sorry, CrowdHealth, like 119 grand. We're like, hold on.
Not happening.
We knew what it was. We knew it was not even close to $119,000. Her final price, any guesses?
I'm going to guess a 90% decrease, so
more.
20,000?
$4,000 was the ultimate price, was $4,000.
That's so crazy.
And so all that lady did was she just called us and she's like, here's what they're telling me. And we're like, no, that's wrong. Like, they're trying to screw you, and so we helped her through that. So in the ER example, you consolidate those bills, you just upload them via the app, literally just take a picture of it, upload it via the app. We'll negotiate, we'll get the price down, and then we'll say, hey, are you cool with us going and crowdfunding this? We got the $4,000 price. And you're like, great. So we go out, we ask, if it's $4,000, let's just say we ask 40 people for $100. I think my math is right on that. And those 40 people can then either say, yes, I'm going to help, or no, I'm not going to help. If they say yes, then $100 goes from their account to your account. And then we go through the 40 people until we get that $4,000. So you have $4,000 in your account. You now have a bill for $4,000 because that's what the hospital has agreed to. And you just pay the hospital directly out of that account for $4,000. So it's pretty easy.
Yeah.
It's super simple.
That's fascinating.
And there's no, explanation of benefits or anything like that you get your insurance plans.
20 pages of paperwork.
20 pages of paperwork that you have no idea what it means. I went to Stanford, the number 2 guy in my class, who's one of the smartest human beings I ever, known. He's like, look, there's, 2 things I don't understand. One is how the government comes up with my property taxes. Like, where'd you get that from? Yeah. And 2 is explanation of benefits for insurance plans, right? Like, those 2 things, you're like, I have no idea.
It's another language.
It's clearly not created by, a consumer-friendly organization because, what are the most, like, consumer, Apple or something. Like, it's not like an iPhone where you can easily understand what's going on. Like, they make it obscure so that you don't understand what's going on, and you're just like, I don't know, I guess I gotta pay it.
Yep.
We deal with that for you, so it's just super easy on you, and we take out all that friction. So it's pretty easy thing.
That's an interesting idea.
But really quick, why would one of those 40 people say yes? Because when you submit for your ER bill to them, they will see, have you said yes to others in the community? Have you been a good community member, or have you said no, which means you're a crappy community member?
Yeah.
All the bills, as I said earlier, that are submitted to the community from good community members, like they help other people, have gotten funded. All the bills not all the bills, but most of the bills from bad community members have not gotten funded. And so people know
More incentive.
People know that when you're submitting these things to them, like, have you helped other people or not? Like, it's clear. What you decide in that situation.
Well, back to like the old town analogy, like a small town in Kansas back in the day, you would see these people going to the store, going to your church, going to the saloon. You would see them. You would talk about them. You would talk with them. People understood do you know what? Here's an interesting. I wrote a newsletter about this yesterday. Do you know what the word name comes from? It originates from a word meaning reputation.
Huh.
So they understood your reputation.
Mm-hmm.
Like they knew what your name actually meant because your life proved it to them by actually seeing it in real time.
Yeah.
So that's like a cool, like social proof way of checking that out.
I love that. I love that. And back in the agrarian communities, like they didn't have a government or health insurance plans to help them out. Yeah. Like they just like, we're in this, let's do this, And I think, man, that's a beautiful way to live in many, many ways, where I know I've got community members who are going to help me out if I have problems. I want to get back to that.
Yeah. I mean, it sounds like you are, which is really cool. One more, I have two questions on the actual like mechanism of it. Number one, how does CrowdHealth, like what leverage does CrowdHealth go to these hospitals and these doctors' offices with to negotiate? Like why would a hospital or an office, a medical practice, be inclined to negotiate on those prices?
Yeah, that's a great question. So we have an attorney on our side who will negotiate those on your behalf. And so the hospital has a choice. They're like, okay, I can try to get, $100,000 out of this person. And, they could say, okay, well, I'm going to, take them to court or whatever, which actually costs them more than, what it's worth. Or I can negotiate. And almost every time they're like, okay, I'll actually negotiate. We also have kind of a list of prices that are reasonable and fair prices. And we're like, look, you're clearly, trying to charge a price that is not fair. That's extortion. And so we also have legal abilities on our side to go after some of these hospitals and say, you just can't extort people out of their money. Mm-hmm. And so, oftentimes it takes, 3 or 4 months to get them to realize that. And almost every time, the hospitals will be like, okay, let's actually negotiate here. And look, for everything else in our lives, like we have a choice what price we are going to pay for a specific service. With hospitals, especially ER visits, we don't. Like we're, what are we going to do? Like we have one choice most of the time.
Refuse getting something fixed or something?
Yeah, exactly. And so there is no agreed upon price as you enter the hospital. And so there's actually a law that says, look, if there's no agreed upon price up front, you have to negotiate a reasonable price after the service is provided. Mm-hmm. And so that's the law that we take. It's like, you've got to, negotiate a reasonable price with us. And the fact that we have attorneys on our side and we're willing to take them to court, and we have, they typically will negotiate with us.
When you go to, let's say, Jim's doctor's office, have you guys seen any experience or had any experience where Dr. Jim is like, you know what, I really like working with these crowd health folks. It's easier for my staff. I save money. I make more money. I don't have to work as much on this. Have you guys seen like a practice that's like aggregating CrowdHealth members? If that makes sense, like where is there any particular practices that is like really CrowdHealth friendly that in a particular location, maybe like Austin or wherever a lot of your members are? Does that make sense?
Yeah, no, totally. And there are we have doctors who are referring people to us all the time, being like, hey, I know you're thinking about your healthcare going forward. Why don't you go to CrowdHealth and you can come back to me and pay me in cash? And we don't compensate the doctors for that. They just are referring them our way because, again, they want to get paid in cash. We get about 20 doctors a week that reach out to us and say, hey, can you send members my way? Because I want to get paid in cash as opposed to having to bill the insurance companies. And so, like I said, our biggest advocates other than our own members are doctors. And so that's for sure. We're finding like our favorite doctors in Austin, Texas. And when members call us, we said, is there a good orthopedic surgeon in Austin, Texas? Oh yeah, we've got a great one. Like here's, Dr. Hurt, who's one of our favorites here in Austin. He's an orthopedic surgeon. He does an awesome job. He charges a fair price. Go to him.
That's an ironic name.
Yeah, it's an ironic name for an orthopedic surgeon. Real quick on that one, it's an interesting, maybe it was a year ago, something like that. Somebody tore their ACL on on playing pickleball of all things
In Austin, of course.
In Austin, of course. And she went to an orthopedic surgeon. The orthopedic surgeon was like, hey, it's going to be, it was actually Dr. Hurt, was going to be, I think it was $22,000 to repair her ACL. And so we called him and we said, hey, if we pay you in cash, if we can move you to the surgery center as opposed to the big hospital, which is a way better place to do it, and she is able to pay at the point of care on the day of the surgery, what would you do? And he's like, oh, we could get it down to $12,000. So it went from $22,000 to $12,000 in one phone call. And so those are the things that we can do to help you get these prices down. If you were with an insurance plan, you would have went to the hospital. It would have cost you $22,000, and you would have paid all of that in your deductible, and then the health insurance plan would have paid the rest, maybe if they approve it. And so it's just that's the inefficiency that we're pulling out of the system, and that's just one case. And we've had hundreds, if not thousands, of those cases over the last 3.5, 4 years.
It's fascinating. It all makes sense to me. I think it reminds me of the idea. My friend Noah Heisman, who's an Austin local, I actually just had him on the podcast last week. He has this idea of criticize by creating. And you hear like, okay, well, somebody's criticizing something, which is people are apt to do nowadays, to just criticize. Healthcare is awful. Big food's awful. This political party does this. This political party does this. It's just criticize. His idea is that you actually criticize, like in the real, like true sense of criticize is through creation of the solutions to the things that you're criticizing. CrowdHealth to me is like the pinnacle of what that means. It's like there is a problem. You had the problem. You hated. You're like, this sucks. I don't like being taken advantage of. There's got to be another solution. There wasn't, so you created a solution, and now it's helping a lot of people, which is, I think it's really, really cool. Yeah,
and also I think you can criticize by joining. Like if you see if you don't like something going on, there's probably an alternative movement. Join it. And I know this sounds like like I'm promoting CrowdHealth because I kind of am.
Yeah.
Look, if you don't like the healthcare system, then get out of it. If you don't want to get out of it, then stop moaning and groaning about it, because you've made the choice to be a part of it.
100%.
So we say opt out, exit the system and join us. And we're trying to create a movement to really change the system. So if you want the system change, come and join us.
Same thing with big food. I mean, it's like
big food.
Don't complain about big ag or big industrial food, and
if you go in the middle aisles,
go to Kroger,
right. Like stop moaning and groaning about it.
Go find a rancher.
One of the things that you mentioned earlier is like, look, if you're saving $500 a month, you can go and do the DEXA scans or do the VO2 maxes or do the whatever. You also have money to go and buy really good food, right? Like you now have money to go and get the steak as opposed to the whatever Lucky Charms. And so but
those are better than
I know that's
according to the Tufts University.
How you cannot look at that and say this is absolutely ridiculous and stupidity at its max.
What we're referring to anybody listening, there's a Tufts University nutrition study that said like Lucky Charms, Cheerios, and like Frosted Mini Wheats and probably like 30 other things are healthier than ground beef and eggs.
Yeah,
and it was legitimate. Like it was published.
Legitimate. It was like this has got to be satire.
Yeah.
This has got to be like Babylon Bee or something, or whatever that is.
It's literally real.
Exactly.
Sorry to interrupt, but
no, for sure. So you now have the money to go and buy better food, which creates better health, and that's kind of this circular thing that we want to get created. And I think that's the only way to save our healthcare system.
It's awesome. Last question. You guys obviously 3.5, 4 years old as a company?
Yeah. We started in April of 21, so I guess it's 3.5 years.
Yeah, very cool.
Yeah.
Carnivore Crowd launched when? Earlier this year?
A couple months ago.
Very cool. What's next? Like what's like the next big initiative or move, or like what are the steps that y'all are taking to grow or to help more people?
Yeah, it's a good question because
if you can.
No, it's fine. I mean, I think that we just had a board meeting yesterday. Funny enough, so I'm this is top of mind. Like, what big are we gonna do in 2025? I think there's other things out there that people would like us to help them with that are also very, very broken. One could be, dental, because dental is always an issue with people. We don't currently do dental right now because we don't fully understand it. So we're looking, very hard at dental. And by the way, dental and nutrition also very, very linked.
Extremely linked.
Extremely linked. And so we're looking at some of that. We're looking at expanding our Bitcoin crowd to allow Bitcoiners to pay in a little bit more of a sovereign way. We're looking at some international stuff because we've had a pretty big input level of interest from folks who live outside the United States who also want to participate in something like this because their health systems are all totally screwed up. A lot of Canadians who are like, man, I got to wait 6 months to go see the orthopedic surgeon because I tore my ACL. And it's like, well, you're pretty screwed if you have to wait 6 months to repair an ACL. And so we've got a lot of that going on that I think is going to be pretty cool for next year.
Very cool.
So yeah, I think you'll see some interesting announcements over the next few months.
That's awesome. And it's joincrowdhealth.com, right?
You got it.
Instagram is
Join CrowdHealth.
And then Carnivore Crowd is Carnivore Crowd, right?
Carnivore Crowd on Twitter, so we got right now we have 3 groups. We have our OG crowd, which is our biggest crowd. They're the ones that are have been with us from the beginning, growing really fast. We have our Bitcoin crowd, where they're just Bitcoiners. We're going to allow them to do some cool stuff with Bitcoin. You have to be into Bitcoin to be in the Bitcoin crowd. That actually is a great crowd, super healthy, super sovereign.
Yeah.
And then we have the Carnivore crowd, which is the new, and we have about 2,000 people in this crowd. And then we have the Carnivore crowd, which to get into the Carnivore crowd, you have to have an fasting insulin level. I think it's under 6. Under 6, or a visceral fat level in the bottom 25 percentile. And so, again, the incentives are there. If you let your fasting insulin rise or your visceral fat rise, you're booted out of that Carnivore crowd. So we have those crowds that we're setting up. And so we have a Carnivore crowd Instagram, a Carnivore crowd Twitter. If you're into that, it's more low carb. I'm not watching your plate, but you have to have those visceral fat or insulin levels or fasting insulin levels in those ranges.
That's awesome.
Yeah, it's cool.
It's a pleasure talking to you. Like I said, it's been cool to have my horizons expanded, even like learning about crowd health, and now to be able to have a conversation with you. It's been fascinating. I love what y'all are doing. I can almost 100% guarantee you that in 8 months I'll be knocking on y'all's door.
I'm gonna put it on my calendar.
Yeah, you should. But just fascinating. Really appreciate what y'all are doing. It's awesome.
Thanks for having me.
Yep. Good deal. Thank you very much.
Yeah.